Hello friends, welcome to our channel PKR Vibes Career and Growth. First of all, thank you so much for your time to spending here to learn something new today. Today we will discuss about the CMS 1500 form in medical billing, and the CMS 1500 form is also known as a physician billing and also known as a professional billing form. Total we have 33 boxes in the CMS 1500 claim form, and from box number 1 to box number 13 we will see the patient or insured information, and from box number 14 to box number 33 we will see the doctor is also known as a provider, the provider information also, and also the service information, whatever the treatment is given by the doctor to the patient information also we can see from the box number 14 to box number 33. Guys, if you are watching my video first time and if you're not yet subscribed, could you please subscribe our channel PKR Vibes Career and Growth and hit the bell icon so that you will get every my video as a notifications to you. Guys, now we are discussing about the box number 24 in the CMS 1500 claim form. See, box number 24 we will see sub boxes like 24A, 24B, 24C, up to 24J. So now we will discuss about each sub box, and here the 24A stands for date of service. So we all of you know, right, on which date the patient visited to the doctor and taken the treatment from the doctor is known as a date of service, because service is given by the doctor to the patient on that particular date. So that is why it's called as a date of service. Sometimes what happen, for example, patient is admitted in a hospital and he should be admitted for example 3 days, then date of service range will be there from the beginning date. I mean, when the patient is admitted into the hospital, that is the beginning date of service, and when the patient is discharged from the hospital, is that date is known as a discharge date of service. Then we should have to enter the date of service range in the box number 24A. And coming to box number 24B, it is a place of service, nothing but the place where the service is given to the patient. For example, sometimes in emergency room the service is given by the doctor to the patient. That place should be entered in the 24B. For example, it is emergency room, you should have to enter the place of service as a 23, so that insurance understanding that service is given at the emergency room. And coming to the 24C, so it is emergency type, the service is like emergency type or not. In that way you should have to give that yes or no details in the 24C. And coming to the 24D sub box of 24 box, here 24D is telling that it is a procedure code or CPT code or equic codes. So if CPT code is mentioned in the 24 D, we have to understand that okay, this kind of CPT is given to the, I mean this kind of treatment is given to the patient by the doctor. In the box number 24E we can put diagnosis pointer. So before that, we all of you know that in the box number 21 we will see the diagnosis codes. So here diagnosis 4E means it is a pointing the, here the we are putting CPT code 24D, and 24E we are mentioning that the diagnosis pointer is for example A means in the box number 21A, in the 21A we will see one diagnosis code, we are pointing that diagnosis code, we are pointing particular diagnosis code, that is why it is known as a pointer. So diagnosis pointer means you should have to, for example A you have to put here, in the sense 24 in the 21 we have to select A as a primary diagnosis code. So that is why for example I am given here 24E as A, for example nothing but primary diagnosis code pointer. Coming to 24F, it's a price box or charges. What is the charges? We will see the charge amount for that particular treatment. Coming to 24G, it is a quality or minutes. Here 24G is nothing but it is like what kind of how many like how many days or how many units of services given to the patient. That kind of details, quantity, it should be entered in the 24G. So for example, enter the number of medical visits or procedures, how many procedures are given, how many kind of units of anesthesia time is there. That should be also entered in the 24G. For example, what is the oxygen volume, and what kind of items, and how many items, and how many units of service is given by the doctor to the patient. That kind of every information should be entered in the 24G in terms of quality, I mean quantity. Coming to 24H, it is a EPSDT services. So early periodic screening, diagnosis and treatment. If it is taken, you have to put yes, otherwise it is no. So in that way it is entered. So coming to 24I, it is a NPI identifier. So there is identifiers like a B1B, D1D, like that. So you have to put, you can also see NPI identifier. Coming to 24J, it is a like rendering provider NPI. We know there is a two doctors, like referring doctor and a rendering doctor. So coming to box number 17, we see the referring doctor details and the referring doctor NPIs. Coming to 24J, we can see the rendering doctor NPI. So nothing but who is giving the treatment to the patient is called as a rendering. So rendering is nothing but performing or giving. So is nothing but, so rendering provider NPI. So we can see the NPI number 24J. So if anyone asking in interviews where you can see the rendering provider NPI, nothing but 24J box, we can say the rendering provider NPI. It is in the 334 format. So it is a 10 digit number, 334 format. It is issued by the CMS, Centers for Medicare and Medicaid Services. This is about the box number 24. Guys, if you felt the content is useful, could you please like our video so that it will reach us many more needy people. And thank you for your time. Thank you for watching. Have a good health. Bye for now.